Hello, my name is Brittany Baker. I am a family nurse practitioner and a DNP student at East Carolina University, located in Greenville, North Carolina. The following presentation is a healthcare policy analysis, and that analysis will focus on the sexually transmitted disease treatment and health department's policy that was outlined by the North Carolina Division of Medical Assistance. So the purpose of this presentation are listed here. One would be just to provide a general overview of the STD treatment and health department's policy as outlined. Two, also to discuss the background information that supports the implementation of the current policy. I'll also review some of the local, state, and national influences or key influences that led to the development of this policy. We'll review some ethical considerations of the policy and overall STD treatment in the United States, and then propose a possible modification to the policy as it stands. So the STD treatment policy in healthcare departments was initially established in December of 2003, and the most recent amendment was made in October of 2015 with various changes throughout the years in between. This policy is specifically intended to outline the treatment of sexually transmitted diseases within the local health department setting, and treatment is defined as the medical history, examination, any laboratory testing that's applicable, subsequent treatment, and then any necessary referrals needed as a component of the STD treatment. Service eligibility, as outlined by the policy, indicates that individuals must be enrolled in either North Carolina Medicaid or North Carolina NC Health Choice Policy. And I just made a brief notation here that the NC Health Choice Policy only applies to those persons between the ages of 6 and 18 years old. So when looking at the STD treatment policy, here are some of the general criteria. The procedure, the product, or services outlined for the STD treatment must be individualized, specific, and consistent with the symptoms or a confirmed diagnosis, and must not be in excess of the client's needs. They must be safely furnished in the setting, and there should be no equally effective or more conservative or less costly treatment available in the state. And the treatment must be furnished in a manner that it's not primarily intended for the convenience of the patient, the caretaker, or the provider, but is consistent with national treatment guideline recommendations. Provider eligibility criteria, it must be a physician, a nurse practitioner, a physician's assistant, or a public health nurse who has completed enhanced role RN training within the field of STDs. That provider must be a participant in Medicaid for North Carolina, and then the NC Health Choice Plan. They must have a current signed Department of Health and Human Services Provider Administrative Participation Agreement, and the provider must only bill for services that are within the scope of their clinical practice. So to give some background information as to why this policy is instrumental in addressing a public health concern, there's a few statistics here that I wanted to share with you. So for the last 3 consecutive years, STDs have increased across the United States. We are currently seeing about 20 million new cases of STDs in the U.S. every year, and half of those cases affect persons between the ages of 15 and 24 years of age. In perspective of North Carolina, the state ranked number 3 out of 50 for cases of chlamydia, number 2 for cases of gonorrhea, and number 4 for cases of syphilis in North Carolina. And sadly, there were also 27 cases of congenital syphilis reported between the years of 2011 and 2015. And then also, data supports that provider education is something that should be addressed as we seek to improve STD treatment services and the availability of these services. So when considering some of the key influences, both at the local and state level, and then also the national level, A key influence would be the STD infection rates. So presently, sexually transmitted diseases that were once at all-time lows or nearly eliminated are starting to peak again. So for that reason, those are definitely key indicators of a need for this policy. At the local level as well, we face socioeconomic hardship amongst populations, and those needs need to be addressed. And this policy allows for the health needs to be met for those persons experiencing socioeconomic hardship. At the state level, the CDC does provide funding to the State Department of Health that makes this program possible. And then nationally, the CDC is a nationally run program, so that would also be a national influence as well. But then, like I said before, the STD infection rates are the most influential factor in relation to the establishment of this policy. When we look at some of the ethical considerations, so based on the data, these STDs disproportionately affect Blacks. When you look at the cases of congenital syphilis, most of the cases were found in Black women, especially in North Carolina. And then also, men who have sex with men are disproportionately affected. And as I stated previously, persons between the ages of 15 to 24 years of age. So looking at the policy as it stands, the policy does outline that testing and treatment must be provided within State Department of Health. So my first proposed modification would be that these treatments and services can be provided at outside facilities. The policy does specify that there are some appropriate referral sites within the state of North Carolina for which individuals can utilize for treatment and testing, but I would even propose that services can be provided at a wider number of outside facilities. I think overall this would improve the disease surveillance. You would have accessibility to persons who live in more rural communities. So you would have increased visibility to prevalence of STDs in those settings. Obviously, it would increase the healthcare access points for individuals in the state of North Carolina, and then ultimately, hopefully improve patient outcomes and adherence. If a person has a local access for healthcare as opposed to having to travel a distance to receive that same care, we find that they are more likely to be compliant with medication regimen and more likely to be compliant with recommended follow-up for things such as a test of cure, subsequent partner treatment after treatment of the client, etc. And then these things would ultimately result in reduced STD infection rates. My second proposal would be that this policy is expanded to include uninsured individuals. As it stands, individuals outlined in the policy only are those who are enrolled in either NC Medicaid or NC Health Choice. So I would propose expanding it to include uninsured individuals as well. I certainly believe that this would help to address the healthcare disparities that were outlined previously. So it would improve, it would get services to more people and improve the rates of treatment for those who wouldn't otherwise be able to undergo treatment. And then that would ultimately reduce the overall STD infection rates within the state as well as at the national level. So those are my two proposed modifications to the policy as it stands. So here are the references that I utilized in order to compile this presentation, and please don't hesitate to let me know of any questions and concerns. Again, my name is Brittany Baker and I am a DNP student, and this has been a presentation outlining the STD treatment policy in local health departments, and that policy was put in place by the North Carolina Division of Medical Assistance. Thank you so much, and I hope you have a good day.